Good morning. This is again Anna Davis with the Oregon Health Authority Healthcare Regulation and Quality Improvement section, and we're here today for a hospital staffing webinar with a focus on civil monetary penalties that OHA can assess as part of the complaint process. So we are going to get started, and I will pass it to Kimberly Volker.
Hello, my name is Kimberly Volker. I am the hospital staffing policy analyst who oversees the investigations. And as Anna mentioned, today we'll be talking about the civil monetary penalties. And so what we'll be doing today is we'll talk about the enforcement process. Then we'll talk about violations and penalties. We'll talk a little bit about the investigation report and enforcement notices. And then we'll also talk about questions and answers. And that's actually going to be, or not talk about, but offer a spot for questions and answers. And that's going to be a big portion of this, this webinar this morning.
We do have some questions we've received in advance, and you can submit questions as we're speaking. And Kimberly, do you want to say how they should direct those questions?
Yes, so we do have, you'll notice it's in all caps. It says send questions here. So please do send those questions to that location. If you send them directly to Anna or myself, we may not be able to see those and we may not be able to answer them. So please do send those again to send questions here. All right. So with that, let's jump into this. So we'll talk about the enforcement process. And this is really relevant to the shifts that occur on or after June 1st of 2025. After those shifts, you get into the process with warnings and civil monetary penalties. OHA will issue a notice of intent for both warnings and civil monetary penalties with hearing rights. And we'll go into that a little bit more with that enforcement notice later on. That penalty schedule, so the amount of fine, would depend on whether the violation is in ORS 441792 subsection 2 or 441792 subsection 3. And again, we'll show you what's in both of those in a minute. And then OHA issues a final order by default if the hospital does not request a hearing. So these are the violations under ORS 441.792 subsection 2.
And that's how it is today. We know that HB 3294 is going to make some changes to this. We will have a webinar in the future that will go over those specific changes and answer questions about that.
And my understanding of that is that those additions will be in 792 and won't affect 793 as much.
That's correct.
So we have right here the violation type. On the right-hand side, we have the statutory authority. So the exact place where you will find that violation in the statute, as it is right now, again, with 3294, when that goes into effect, things might shift a little bit. But the violations under 441792 subsection 2 is failure to adopt a hospital-wide staffing plan, failure to comply with staffing levels set by an adopted staffing plan, mandatory overtime for a nursing staff member, so that's an RN, LPN, or CNA, failure to comply with the CNA maximum patient assignments in statute, or failure to establish a staffing committee. And so you can again see on the right-hand side how that breaks down as well for nurse staffing, professional technical staffing, or service staffing. And so for those violations in 441.792 subsection 2, this is what the penalty schedule looks like. So the first violation of that would be a warning letter.
And again, this is the first violation after June 1, 2025. So for allegations of non-compliance that occurred on or after June 1.
Precisely, yes. The second violation would be $1,750. The third violation would be $2,000 $500, and each subsequent violation after the third would be $5,000. So the violations under ORS 441.792 subsection 3 is failure to release a staffing committee member to attend a staffing committee meeting. And that again applies to nurse staffing, professional technical staffing, and service staffing. And so that one has a little bit of a different penalty schedule, as we mentioned. That first violation, again, for shifts starting on or after June 1 of 2025, the first violation is a warning, and then each subsequent violation afterwards is $500. So you're not seeing that same sort of scaling that you'd see in the subsection 2. So the investigation report, how that works with those violations, you'll see that the summary section in it will list the number of violations identified during the investigation. Later on in the report, usually under the analysis, you'll see each complaint will reflect whether the facts and findings identified during that investigation reflects compliance or non-compliance for the allegations that were made in the complaint. So you'll know if you filed a complaint, whether we saw compliance or non-compliance associated with that individual complaint. That report does not reflect the specific actions OHA will take in response to the identified violations. That comes on the next page with the next document.
So the report itself will say there were 3 violations, 4 violations, but it doesn't say what the sanction is.
Exactly. That instead comes in the enforcement notice, which is titled as Notice of Intent to Issue Sanction. So it gives the notice of the findings of facts, the findings, and the proposed sanction to be issued. So if that sanction is monetary, it would also provide the amount of that monetary penalty. It also describes a hospital's legal right to a contested case hearing, and that notice of intent to issue begins a 20-day period during which the hospital may request that contested case hearing.
So it would be a notice of intent to issue a warning, notice of intent to assess civil penalties, or it could actually be a combination. If there are multiple violations in that report, there could be a notice of intent to issue warning and assess civil penalties.
And so we are at the questions and answers section of the webinar. So we have some questions that were pre-submitted, but go ahead and submit them now as well, and we will keep answering questions as they come in.
So one of the questions we have is, do warnings start over now that there are penalties, or will the prior warnings that were issued before June 1 of 2025 mean that the first violation now is a civil monetary penalty? We actually have that, we have language about that in every report that goes out, and it's clear that if the non-compliance occurred before June 1 of 2025 and there was a warning issued for that, there's a start over process on June 1 of 2025. So non-compliance on June 1 results in a warning if that's the first non-compliance. If we were to get multiple complaints about June 1, then you could have the first and the second on that same date. But the warning that was issued in February of 2025 does not count towards that accrual.
There's a question here. For a violation report, what information is needed from the reporting nurse? I think that's asking about the investigation report. And so what you'll have happen is the nurse would be filing that complaint form via the complaint website, and you'll notice the complaint form should walk you through with those specific pieces of information that we need to determine first, is the complaint even valid or is it invalid? Because we can only, by law, we can only investigate complaints that are considered valid. So the ones that, if assumed to be true, does it represent one of those violations we just showed you? So essentially just fill out the complaint form, and that will most of the time get us exactly what we need.
We do on occasion reach out to the complainant and ask for additional information if what we've received on that form is not enough information for us to make that determination. But as Kimberly said, if you answer the questions on the form, we should be getting the information we need. We have a question about whether a hospital can require you to stay on premises and respond during a lunch period. And at this point, I want to point out that OHA is not enforcing the meal and break provisions. If somebody misses a meal or break, if they are unable to take their meal or break, that's actually with BOLI. So you can file your complaint on the OHA complaint website, but the investigation and all of the legal determinations around that are done by BOLI. They are not done by OHA, so we're not the best folks to answer those questions.
Yes, and I'll note too that we see that there are some questions in the chat about BOLI communications and BOLI process. Like Anna mentioned, we're not the people to direct those to, because we also have questions. We don't necessarily know what that process is. What we can do is put their contact information in the chat if people do have questions and wanted to direct those to BOLI, but we wouldn't be able to answer those questions. And Anna, I'll also address that there is a question about that bill that we just referenced, HB 3294. At this time, we are still looking at that and looking at how that's going to affect our implementation processes. But like Anna said, we'll have more information on that coming soon.
We have a question about whether hospitals, there's a question about hospitals having acuity and intensity in their staffing plans. And what I would recommend is we have some short videos, including one on nurse staffing plans. And that's always a good spot to find out what is required in a staffing plan. At this point, we do not require that a hospital have acuity and intensity in its staffing plan. That was under the old law, that was a requirement. Under the new law, that is no longer a required element of a plan. Hospital can have that in their plan, but we can't enforce a requirement that's no longer in the law.
We have a question about whether CMPs are being put through to hospitals with the expectation of payment without any indication of whether the complaint is valid. And so to walk through, again, that process a little bit, we would first receive a complaint from a hospital staff person or an exclusive representative. And the very first thing our team is going to do is we will triage that complaint to see, is that something that is valid? So was it submitted within 60 days of the alleged violation? And is the situation that's described in the complaint, does that represent, if assumed to be true, a violation under 792 subsection 2 or subsection 3? If the answer to both of those questions is yes, it could be a violation if it was true and it was submitted within 60 days, then we move forward to schedule an investigation. And we do that full investigation process. We have a webinar that describes it in a bit more detail. So I won't be a broken record for you all here today. But we will do that investigation process. And then only after that investigation, if we see that there is a violation for that complaint as identified as part of the investigation, that's when you move on to that enforcement process where we look at warning or civil monetary penalties.
We also have a webinar. I want to flag a webinar that talks about valid, invalid, substantiated, unsubstantiated, because we don't investigate any complaint that is not a valid complaint. And by valid, I mean it's received within 60 days of the incident and it alleges non-compliance with one of the limited number of complaint types that we can investigate. So if we start an investigation, we have determined it's a valid complaint. Then in the investigation, we determine whether the complaint is substantiated or unsubstantiated. Substantiated meaning we can prove that that non-compliance has occurred. So I would definitely direct people to that short video about valid, invalid, substantiated, unsubstantiated for more detail on that. But that's something that's important to keep in mind.
I see a question here. Will OHA fine hospitals daily for not having a hospital staffing plan? And that again gets back to this is a complaint-driven process. So it depends on what the complaints show. So if we receive a complaint that the hospital doesn't have a nurse staffing plan on one day, and then we have a different complaint that it's on another day, we would look at both of those, but I'm going to use actual dates. June 1st and June 5th, let's say that. So we would look and investigate for June 1st, June 5th, and if we saw that there's not a complaint, or sorry, there's not a nurse staffing plan on June 1st and June 5th, we would cite violations for both of those days. Now, we don't have complaints in the middle of that range. We're looking at June 1st and 5th because this is an investigation-driven process.
And we're looking at a hospital-wide staffing plan. So if we get a complaint that says on June 1st, we didn't have a plan in the ED, and we get one on June 5th that says we didn't have a staffing plan in the ICU, we would investigate both of those. And if we found, yes, on June 1st, there was no ED plan, and yes, on June 5th, there was no ICU plan, that means on those two dates, the hospital failed to have a hospital-wide staffing plan because at least one of the units didn't have a plan.
And you'll see that reflected in some of our newer reports. And we already have some reports that are completed and on our website. You'll see them by their case numbers, which will all start with, well, it all starts with the hospital abbreviation, and then 2025-06, because those investigations all started in June. The last two numbers depend on the date the specific investigation started. But you can see that language, how we describe these complaints all deal with failure to adopt a hospital-wide staffing plan on this particular date.
And if we were to get two complaints about June 1st, one for the ED and one for ICU, that still results in a single violation. We would investigate both of those, but it results in a single violation because the violation is failure to have a hospital-wide staffing plan on that date. There are, I will say, on our website, a lot of reports because there are the 385 reports from before June 1st, somewhere around there.
There are a significant number of the old ones are on there. And that can be seen under the investigation reports as well. I'm curious, because yeah, it is a significant number. It is over 100 for sure.
385 complaints.
Yes.
But we do bundle the complaints, multiple complaints, into a single report. We have a question about retaliatory actions taken against a staff member who files staffing complaints. So there is a whistleblower law. Those complaints about retaliation actually go to BOLI, the Bureau of Labor and Industries. They are the ones who enforce the whistleblower law. Kimberly, do you want to answer? We have a question about the differences between missed meal versus staffing plan deviation.
Absolutely. And so as we mentioned earlier, I can speak a little bit more to one than the other. So those meal and rest break complaints go through BOLI. My understanding is that there is a provision where some of that, there might be a monetary piece that can be received by the person filing the complaint if they file with OHA. And then OHA would still refer it to BOLI. BOLI still investigates. But my understanding of all of those other monetary penalties happening on in BOLI's area, it's all BOLI's side, so I'm not as comfortable speaking to that. But I can speak to the staffing plan ones, and that's all of those violations under these 792 subsection 2. And so that is going to be that sort of scaling, penalty that we looked at before with that warning. And then, if I'm remembering correctly, the 1,500, 2,500, 5,000.
1750.
1750? Okay. I clearly don't have these memorized yet. But that is where the staffing plan violations come from. Notably, I do want to point out that there is sometimes a bit of a difference between a deviation and a violation, because deviations do include those situations where someone deviates, a unit could deviate from a nurse staffing plan. They are allowed to deviate from the staffing plan up to 6 times in a rolling 30-day period, and it's considered a permitted deviation if it is reported to the nurse staffing committee or professional technical staffing committee or service staffing committee within 10 days. So permitted deviations are not violations. They wouldn't be triggering the civil penalty process. Once you go above 6, you have 7 plus in a 30-day rolling period, that would no longer be permitted. That becomes a violation. Civil monetary process starts.
We have a question about how soon after a low staffing event will the hospital be fined? And so that's really going to depend, because let's say there's an incident where the hospital doesn't follow its staffing plan. First of all, we don't know that that happens unless a complaint is filed. So the complainant has 60 days after that incident to file their complaint. We then have to determine that that's a valid complaint. Was it filed within 60 days? Is it about one of the provisions we can enforce? Then we begin our investigation. When we do that, the hospital has 20 days to provide us with the necessary documentation that we request. We then review that documentation and write our report. After we send out that report, then we issue that enforcement notice. So, and the hospital at that point can request a hearing, or they can choose to just pay the fine. So all of that takes a significant amount of time. If it goes to hearing, we're looking at more than 6 months. If it doesn't go to hearing, we're still looking at probably close to 6 months when we think about, well, you've got 60 days to file the complaint, and then 80 days for the investigation, and then the notice.
And the 30 days to schedule and start it.
That is true, the 30 days to schedule and begin the investigation. So it's not an immediate, it is a multi-step process. We also have a question about how far between complaints until there's an escalation. And the question asks if there's a staffing committee or a complaint about a lack of a staffing plan on June 1st, and then another one on June 2nd, would it escalate? It absolutely would. If both of those were substantiated, then June 1st would be a warning, June 2nd would be a civil penalty.
And it does ask as well, I see that question, if there's a time frame. This is all for a 4-year period.
Yes. So if there's a warning and there is no subsequent warning until 4 years later, then it would be a warning again. But if there is another violation within that 4-year period of that same kind, then it would be a civil monetary penalty.
I see a question about where the penalties go, and if that goes to staff or if it goes somewhere else. The staff portion of it, I don't know what BOLI's portion is. The BOLI might have something where some portion of it goes to staff, but again, that would have to be directed to BOLI. For ours, my understanding is that all goes to the general fund. So it's not coming back to the hospital staffing team, it's going to the legislative general fund. It
doesn't go to the hospital staff either.
No.
It goes into the general fund, and we have no authority over that money. We have a question about if management submitted what is being called an interim staffing plan without approval from labor, how is that addressed by OHA? Again, OHA only knows that there is a staffing plan issue if there's a complaint. We do not review those plans that are submitted to us. We post those on the website. We do not have the authority to review them, nor do we know whether they are the approval process. I do note that when they're submitted, there is an indication in the submission form that it has been properly approved, but we don't investigate that. We post it. That is what we are required to do, is get the plan and post it. So if there is a concern about a hospital implementing a plan that has not been approved, then the complaint would be, we don't have an approved plan. OHA posting a plan that's not approved is not in and of itself a violation. The violation is if there isn't an approved plan, or if the hospital has implemented a plan that's not approved, because that is also, we don't have an approved plan.
I also see a question asking for clarification about the complaint forms, saying that they've been told that any complaint that comes in within a 30-day window is considered valid. So to clarify that, for a complaint to be valid, and this has been our process since September 1st of 2023. I will say the complaint form has changed a few times to make things clearer, to make it so that it's more likely we don't have to come back and ask for additional information. But since September 1st of 2023, for a complaint to be valid, it needs to be submitted within 60 days of the alleged violation, and the information provided in that complaint needs to, if assumed to be true, be a violation under 792 subsection 2 or 3. And so again, we have made those complaint forms hopefully clearer and easier to get the exact information that we need to us. But that's legislatively, statutorily, what a valid complaint is.
We have a question about whether OHA has been able to increase their efficiency, and if we're able to complete our investigations within the time frame in the staffing law. And I can give an answer that's for right now. Yes, we have done a lot to increase our efficiency. We have new staff who are doing an amazing job. And there's a giant caveat here. There's a big but there, which is June of 2024, we had the most complaints we had ever received. We received 704 complaints in June of 2024. And it took us quite a long time to try to get through those complaints from just June of 2024. So in June of 2025, we received over 1,300 complaints that related just to June of 2025. As efficient as we are, it is entirely possible that we will not be able to investigate and complete our investigations on time, given this tremendous increase in volume. Just for comparison, before June of 2024, we received an average of 1 complaint a day. In June of 2024, we were receiving
about 37-ish.
About 37 a day. So if you think about that and you think, well, now we got 1,300 in a month, we can begin, and the complaints we have begun since June 1 of this year have completed on time, but it is a significant challenge, and it is likely to only increase. We have 500, and
I think we have even more now. Oh yeah, it went up since we last spoke. It's now 579 with
complaints under investigation today,
with more starting today's Wednesday. So yeah, more starting today, more starting tomorrow. We have all of those have started on time. As Anna mentioned, we are starting to hit a point where there's more complaints than time to address those complaints, but everything so far, all of those investigations have started on time. We have completed investigations already for 51 complaints. Those would have been due mid to late August, and so we got those out end of June, early July. So we are able to be ahead of schedule for some of these, but we are looking at a rather massive volume right now.
And tied to that, we have questions about, are there plans to implement processes that will reduce the administrative burden? We have hospitals that have received over 100 complaints that are under investigation at this time.
So we have a few different things that we are looking at, and we are wanting to get feedback on them and hear back from people about these. We are looking at some investigation tools to try to gather that information that often requires us to do follow-up and can significantly slow down the complaint process. We've heard from some hospitals that works well, and we've heard from some hospitals that have concerns, and so we're looking more into those. That's our main one that we've been doing so far. Is there?
I would also say that part of the legislation, this 3294 that is still waiting for the governor's signature, would allow us to not investigate duplicate complaints. So if we get a complaint that says we didn't have an ED staffing plan on June 1st, and then we get another complaint that says we didn't have an ED staffing plan on June 1st, under the law as it is currently written, we have to investigate both of those. And under 3294, we would be allowed to say, hey, that second one, we don't have to investigate because it's about same shift, same day, same unit. So that would be an improvement. In terms of reducing the administrative burden on hospitals, we do recognize it. We understand that this is a big lift. We don't have any discretion to not investigate the complaints we get that are valid complaints. So we understand that this is a big ask. It's a big ask for our team as well.
And we've told hospitals to for those tools with the adopting a staffing plan, if you've already filled out one and then we come back and ask for it again, you can just say this still applies. Like this tool that was already signed, it still applies
for this other date.
Yep. And so we want to make this as efficient as possible for everyone. We all know that we're all looking at a lot of complaints right now. I will say briefly to those investigation tools, we do have a webinar scheduled in a couple of weeks. The next slide gives you the time on that. But right now we're still on questions and answers.
We have a question about whether staffing plans expire in 12 months. There is no expiration date on staffing plans. Staffing plans needed to be adopted, new staffing plans for nurse staffing needed to be adopted after September 1, 2023 and before June 1 of 2024. If there's a plan that's been adopted after that, then that would be a valid plan. Professional, technical, and service staffing plans needed to be adopted by December 31 of 2024. The nurse staffing law actually has a requirement that the nurse staffing committee review that plan every year. That is, there are no enforcement provisions in that law, so OHA does not enforce that annual review requirement. As long as a plan has been adopted after September 1, 2023, the hospital can continue using that plan for as long as it is functional and appropriate. And it's really up to the staffing committee to decide, is it functional and appropriate? Does it need to be updated? There is no requirement for the annual review of professional, technical, or service staffing plans.
I see a question here. If a nurse staffing plan, service staffing plan, professional technical staffing plan, if a staffing plan has more than 6 deviations, does safe harbor still apply? That's actually only when safe harbor applies, when it has more than 6, because safe harbor only applies if there is a violation. So if you have a permitted deviation, so it's between 1 and 6, and you've reported it within 10 days, you don't have a violation. And the report would say, there's no violation with this one. But when there is so I suppose if you don't report within 10 days, you could, yeah, I see Anna here. If you're not reporting within 10 days, now you could have a violation, because to have a permitted deviation, it needs to be 6 or fewer and reported to the appropriate staffing committee within 10 days. And so safe harbor, that's let's see if I can remember my statutory reference, 793 subsection 4.
Yes.
Yes. So safe harbor describes the situations in which OHA will not issue a civil monetary penalty for a violation.
So there is a violation. It has been substantiated, but the hospital has taken a variety of actions, and the hospital has to take all the actions to try to avoid the non-compliance. And by doing so, the hospital then doesn't get penalized for the non-compliance.
And during some investigations, we've actually had some hospitals tell us, oh, we didn't submit the safe harbor documentation because we didn't recognize that there is a deviation on this date. And so it wasn't reported within 10 days or anything. And we clarified, no, this safe harbor is really only considered if we're looking at a violation. So that's not going to be tied to that permitted deviation at all. It's really about, is there a violation here?
And we do actually have a short video on that too, on the difference between safe harbor and permitted deviations.
So when in doubt, if you are having that safe harbor situation, that's applying to a violation of a staffing plan. So failure to follow a nurse staffing plan, professional and technical staffing plan, or a service staffing plan. So if your investigation is dealing with one of those 3, do please submit that safe harbor documentation, and that will help us from the get-go.
So we have a question about, now that BOLI is processing the meal and break complaints, is there a reason OHA is continuing to send notices to hospitals that a complaint has been received? The answer is yes. The statute requires us to send that notification. That is required in ORS 441791. We have to send the notification to the hospital administrator, the staffing committee co-chairs, and the exclusive representative if there is one. So we do send those notifications letting all those individuals know that a meal and break complaint has been filed with OHA and forwarded to BOLI. That is the end of our involvement with that complaint. So we don't know anything further about it. Those complaints do have our complaint number. BOLI may have their own numbering system, but we do need to keep sending those notices because the statute tells us we have to.
And Anna, I see a question asking about the process for hospitals, their right to contest, the right to request a contested case hearing. So can you perhaps walk them through a little bit again with the sending out the initiation or the notice of intent, and how the hospital would let us know?
So in that notice, it actually says you can send it by email to this address. You can send it by snail mail to this address. You have to request that hearing within 20 days. And then at that point, if we get that hearing request from the hospital administration, then we notify Department of Justice that there's a hearing request, and they start the process to coordinate with the Office of Administrative Hearings. What the Office of Administrative Hearings will do, because that's where the administrative law judges are, They will set up a pre-hearing conference with the Department of Justice and the hospital's counsel or representative to go over any issues that have to be resolved before a hearing date is set, and then the Office of Administrative Hearing will provide some possible hearing dates. And they'll talk about exchange of documents and any sort of housekeeping issues that relate to that. When a hearing is held, then both the OHA and the hospital present their case to the administrative law judge, and the administrative law judge will then issue a written proposed order. And then the OHA issues a final order based on that proposed order. Appeals from the Office of Administrative Hearings go to the Oregon Court of Appeals.
I do see several questions about different tools and whether we're making tools or modifying tools. And I do want to say I do appreciate all of the things that are coming in through here. It is always useful and helpful to get feedback about the tools, because we want this to work for the hospitals and for us, and make, like we said earlier, make everyone's lives more efficient. So like I said, I see that there's several questions of, will you be working on this and will you be working on that? And these are things that we're going to take these questions that you're putting in here now about specific tools, and then Anna and I will discuss it after this webinar and look at ways on how we can make some of these work.
And we'll also be getting feedback from the Nurse Staffing Advisory Board, who is meeting
2 weeks.
2 weeks from now. We also have a question about, will there be investigation tools for professional, technical, and service staff? There are already tools. There's a professional technical staffing plan approval tool and a service staffing plan approval tool. They are available on our website already, and we will be doing short videos that go through each of those tools.
We haven't yet envisioned the staffing levels in the same way that you see for RNs and CNAs, simply because we've seen a lot more variation in professional, technical, and service staffing that would make it a bit harder to draft tools for those. So we're thinking about it critically right now to make sure that if we were to make a tool, it would be useful and helpful and fit the variety of different plans that we have out there.
Although we could also at some point make some tools that don't fit in all situations, but we use in the situations where they do fit. We have a question about whether the meal and break are also looked at differently after June 1 of 2025. And what I would say again is that is the jurisdiction of BOLI. That's not within OHA jurisdiction. My understanding is that the law changed for them on June 1st of 2025, but again, that's a BOLI issue. We also have a question about whether we can provide employee details in the meal and break complaint notifications we send. The statute tells us the information that we are to provide, and so that's the information we provide.
It's looking like questions are slowing down a little.
We have a question about a representative can file a meal and break complaint on behalf of an employee. Are there any parameters or when that can be done, or is it up to the union? That isn't something we have control over. The union, as exclusive representative, can file complaints, and we don't have any authority on whether that requires the consent of the individual they're filing the complaint about or not. Curly, do you want to talk at all about, we have a couple questions about CNA assignments?
Yes, so I will talk about how we look at those during an investigation. And this is based right now off the assumption that this is CNA levels in a nurse staffing plan, although they could be in a different staffing plan as well. So during an investigation, we are going to look, uh, we're going to look to see first, are they in a staffing plan? If they are in a staffing plan, we would check what that staffing level is in the staffing plan. So is that a ratio? Is that a minimum number? And the important thing to keep in mind with all of this is that, and here we are testing my numbers again, 441.768, I believe.
So.
Okay. You can see I know where to look. I don't necessarily have them all memorized all the time. But there is that statutory requirement of CNA maximum assignments, 1 to 7 during a day or evening shift and 1 to 11 on a night shift. And so during an investigation, we would first see if you are in a staffing plan for CNAs and it aligns with that 1 to 7 or 1 to 11, we would then check to see, did they exceed, did they not exceed? If the nurse staffing plan, professional technical staffing plan, service staffing plan has that requirement and they're not following the requirement that's in the staffing plan, then we would cite a violation for failure to follow the staffing plan. Now, the situation where it gets a little strange is because that statutory requirement is there, it is in place. If the staffing plan, let's say CNAs aren't in any staffing plan, or the staffing plan says something like 1 to 8 and 1 to 12 is allowed. Well, in that case, if that CNA does indeed have 1 to 8 patients during that day shift, I'm getting all tied up on my numbers, 1 to 8 during the day shift, well, they haven't violated the staffing plan, but you have now created a situation where you are violating that other statutory requirement of the 1 to 7 or 1 to 11.
And 441792 has that requirement of the 1 to 7, 1 to 11 as the enforcement.
And that is a little bit different than the RNs, which ties it directly to a staffing plan. CNAs are existing as their own statutory reference right there in that 792 subsection 2.
Regardless of what it says in the staffing plan.
Exactly. So if we saw 1 to 8, and it could be in a staffing plan, but if that CNA is 1 to 8 during the day shifts, we would then cite a violation for that separate one, and I believe it's F 792 subsection 2 subsection F. We would cite that for failure to follow that CNA maximum assignment in the statutory section.
And similarly, we have a question that asks, if a charge nurse assigns nursing staff in a way that creates a variance, is that a variance? For example, if a staffing plan allows for total patient care by RNs when there aren't enough CNAs, and the charge nurse opts to avoid total patient care by assigning CNAs more patients than are allowed in the staffing plan, and a complaint is filed. So in that situation, if a permitted deviation notification was filed with the staffing committee within 10 days, then that could be a permitted deviation. And if no permitted deviation information was filed with the staffing committee, then that could be a violation.
So we do have a question as well. Rural hospitals can have a different ratio for CNAs or RNs, though, if the staffing committee agrees on it, correct? That's referencing the type A and type B waivers that a nurse staffing committee can approve. My understanding of that is that it's for the RN ratios.
That's correct.
CNAs are not in that section.
That is correct, because that is under 441765.
So yes and no. Yes for RNs, no for CNAs.
We have a question about, could proposed orders from administrative hearing judges influence how OHA addresses complaints going forward? Do they establish precedent? I don't know that we have specific rule or statutory language that makes these have a precedent, but we would always take into account what the administrative law judge has determined, and we would be consulting with the Department of Justice about how that could impact cases going forward. There are times when an agency determines that an administrative law judge has incorrectly determined a case. The administrative law judges are going to be definitely in a learning process because they haven't spent time with the nurse staffing law yet, or the hospital staffing law, and that will come over time. Administrative law judges do develop an understanding as they see more and more cases. And within the Office of Administrative Hearings, they generally assign the same types of cases to the same small number of administrative law judges over and over, so that the same few administrative law judges actually get that understanding of the area of law, because they their usual docket is a significant variety. The Office of Administrative Hearings does unemployment hearings, they do child support, they do all those DMV hearings, they do water rights cases, they do liquor law and more. So they have a huge variety, and so they do try to specialize within that office.
And Anna, I will, just as I do for these, let you know it is 10:55. So if anyone has some last minute questions coming in, otherwise we can talk about our upcoming events and resources. All right, I'm not seeing anything new coming in.
I do see a question that relates to hospitals self-reporting surveys and deviations, and a reference to peer review under ORS 41675. I'm guessing that that relates to the patient safety, the Oregon Patient Safety Commission. That really isn't part of this process. That the hospital staffing law is a separate set of statutes, and ORS 441791 talks about the documents that a hospital has to provide OHA as part of that investigation. So with that, we're going to jump to our next webinar is going to be about the investigation tools. We do expect to do additional webinars, one about 3294.
And if there's topics that you think would be very helpful for a webinar, please do go ahead. We can put our email in the chat. We would love to hear about webinars, about short videos that you might be interested in. And I see Edmund, thank you, Edmund has put the link to the webinars and video shorts that we've already done on our website, but we always love hearing more ideas and want to, we want to have those resources out there for you that would be helpful.
And here's actually a screenshot of what that page looks like. So we have all of the prior webinars under the new law up. And we also have the shorts. We put out a short every week. Sometimes it is an update of a prior short if the law changes on that. But we have over 25 out already, and we send those out on our listserv every single week.
Yes. And I will say as well, Anna mentioned it a little bit ago, but we do have that nurse staffing advisory board meeting in 2 weeks as well. And that those meetings are always open to the public. And so the registration link, if it's not on there yet, it will get posted on our website very soon under the nurse staffing page.
And that this month it's a remote meeting, so it is all on Zoom. And Kimberly, you had mentioned, and I know Edmund put in the chat, the our email address. So you can, if you have webinar or short suggestions, you can email that.
Well, wonderful. Thank you, everyone. Today, we have appreciated your questions, and we look forward to speaking with you all again soon.